Hello, everyone. This is Thais Harris with the Nourish Together Gut, Heart, and Mind podcast. And today, my guest is Laura Rowan from Essential Pelvic Health. And this is such an important conversation for every woman to listen to and to take action on because the pelvic health is so directly connected to overall health and hormone health and bowel movement health. And that's all the things that we're going to, or bowel health, I should say. But those are all the things we'll be discussing today. Thank you for being here, Laura.
Oh, thanks for having me. Yeah, as you know, I love to talk about it all, and that's how we move forward with it, right? Normalizing the conversation. So,
Yeah. So, what I'd love for you to tell us a little bit about you and how you got to this work. But before we go there, right off the bat, what would you say is like the number one most important thing women should be feeling into, looking into regarding their pelvic floor?
ooh, that's a big one. Just in general, I think having an awareness of what it is and what it does for us, because that's the biggest thing. It really has many hats. So our pelvic floor is that muscle group at the bottom of the pelvis, and so I always have my models.
Nice.
And when we think about what it does is it coordinates our bladder health and function. It coordinates our bowel health and function and our sexual health and our reproductive health. It also stabilizes our body when we move. So it's part of our core system. It interacts with our respiratory system, our nervous system, the brain stem. So it's got its hands in like all of the body functions. So being able to know what it's about, and so then you can start to see if there are some things coming offline, like some symptoms or red flags, then you can be able to get intervention a little bit sooner, and be able to have some strategies and awareness to interact with those.
Beautiful. So great. Knowing, having the awareness of what it is. And how do you find, like, when people come to see you, is it more often that maybe they had children or maybe they're having some incontinence? Like, what would you say is the most common thing that bring people to you? And the reason I'm asking this is that the follow-up question is going to be like, how can people start tuning into their bodies so that they can get to see somebody like you before they get to a point where there's a crisis, right?
Yeah, it's a hard question because I do see a very wide variety of people. So I see all genders, all gender identities, and if we narrow it down to people who identify as women, um, it's kind of, again, all over the place. I have the maternal space, so pregnancy and postpartum. But I also have like younger females with pelvic pain. I have, and even younger, as a female athlete, I didn't know it at the time, but I experienced bladder urgency and stress incontinence, and potential prolapse. So all of those things are very, very relevant, as well as hormonal transitions, which we will talk about more, going into the menopause transition, so perimenopause, menopause, and postmenopause. So usually it's either in the area of a bladder symptom, bowel symptom, sexual symptom, pain symptom like back, hips, pelvic, genitals, um, or usually a combination of all of them. So it didn't really give you a
Okay.
great answer, but
No, but this is great because now we can narrow it down to women that are in perimenopause and menopause.
Mhm.
When they come to see you, what's the most common thing that they're coming to you for?
Yeah, I'd say the most common connection that they come to me for is the genitourinary syndrome of menopause. So thinking about the bladder symptoms, so UTI or UTI-like symptoms, um, bladder urgency, bladder leakage, um, painful intercourse, vaginal discomfort and dryness. Those sorts of things are what people connect pelvic health with. And then when they get here, we discover usually a lot more things that we can kind of help balance out, such as the bowel health, if there's constipation or loose stools, and any other like potential pain that maybe they haven't connected to these functions as
Mhm.
well.
So that brings me then to the second part of the question, right? If people can understand what the importance of their pelvic floor, everything that's doing, and also starting to notice maybe changes in their body where vaginal dryness is starting to happen, or maybe there's pain or pain with intercourse, or um, I don't know what else. I want to just list like a few things that if people are starting to notice that, or even like the sneeze, kind of bladder
Yeah.
leakage, right? Connection, that's when they really want to come see somebody, like to not let it get worse, right? To like really start looking into how can I strengthen, how can I support this part of my body so I can support everything else. Would you say that that's the way that
Yeah,
would be
yeah.
helpful?
Yep. And it's great because I mean there's still as much as I still get people that come in every week that say I didn't even know this was a thing. There are a lot of awareness is getting out there. So a lot of people are now coming, like I'll do discovery calls to be able to figure out if this is a right fit, and then we'll look at the schedule together. And in those discovery calls, I see people listing all the things. So they're already making the connections better than they were even just like a couple of years ago.
Hmm.
And then when I send them my intake forms, it asks you all the questions of all the things. So that helps people start to make those connections, be like, why is she asking me about this? And then actually thinking about it. How often do I go to the bathroom? And does it feel like it's a full bladder? Or, just kind of really starting to think about things that you maybe haven't thought about or connected.
Right.
Like sometimes constipation, people don't even identify as being constipated until you
Yeah.
ask the right questions. Um, and then sometimes even like in the clinic, I'll ask the questions, be like, no, I don't strain or push to pee, to urinate or to have a bowel movement. And then they come back the next time, like, you know what? I think I do. And then we can have that conversation. So
Right. I feel like, again, and I know you see male, female, all gender identities, and so do I, but especially for this conversation, and because it is the largest percentage of the people I see for my practice, is women that are in perimenopause and menopause, that there's a common thread of not really paying attention to ourselves and our own bodies so much of the time, that like you said, it's like it's not until it comes into the conversation that people go, oh, maybe I do that. Like, let me pay attention, let me take some time to just really sit with my body and see, like, how am I doing this, how am I doing that, how many times am I going, how, what's my bowel movement like, am I listening to the clues when my body says I need to pee? Do I hold it and do 10 other things before I go? Or do I, so those little clues that are really about paying attention to ourselves,
yeah.
and something that, some women are really good at, but some women are not because they've been used to taking care of everybody else.
Yeah. And
So,
it's,
yeah.
being able to track can really be helpful to get that information. So when we'll talk about different tracking tools that I find really important and key in helping to create programs, but also, being able to not dismiss ourselves, right? Because we are so busy. We are doing so many things that it's so easy to say, oh, well, this is happening because I'm stressed because of all of these things. And being able to really like sit with, if you understand your rhythms and your internal systems well, then you can really know when your responses are a little bit more than just having too much on your plate. And in different transitions like postpartum versus perimenopause, and for example.
Right, right. Well, how did you come to this work, Laura?
So I was out in Boston and I was doing working at skilled nursing facilities. So I worked with the geriatric population and I was a rehab manager. And we had this program that came through that taught us a little bit of bladder retraining program. And so for the geriatrics, with a little bit of mindfulness and some exercises, I was really seeing a lot of great improvement. And I said, wow, like we need to like look into this a little bit more. So I took my first pelvic floor course, which I did not quite understand all that it entailed at the time. And I always thank the universe for putting on the blinders for me because I don't know if I would have signed up for it because a big piece of our training is learning the internal pelvic floor assessment techniques, and we practice on each other. And certainly for the geriatric population, I was not even considering internal. I didn't know that that was a part of it. However, I was there. I think it was in Chicago 18 years ago. And I said, okay, let's see what this is about. And I'm so grateful because it just opened up a whole new world for me. And, I really, of course I was helping people before, but really it just made me feel like I was transforming people's lives and at a greater spectrum, right? So, I've just, I caught the bug. I've been hooked ever since. And really, pelvic health transcends all occupations and settings and people. So it just really, some people are like, oh, I should come see you. I could really use pelvic health. I'm like, couldn't we all? Like, I think we all
Yes.
deserve some pelvic health and awareness.
And how did your work evolve into now being having this hormone portion of it, being a hormone informed practitioner? And I know that you're also training with the Menopause Society. Is that right?
Yeah.
Yeah. How did that come about?
Yeah, actually fairly recently. I think all these years that I've been a occupational therapist for 25 years, been working in pelvic health for about 18 years. And I think all of it, I have been working with hormones because there are hormone receptors all throughout the body. And that's, I don't call myself a pelvic floor therapist. I call myself a pelvic health therapist because it really is so much more than the pelvic floor. The pelvic
Hmm.
floor is interconnected throughout the body, even our brainstem and our nervous system. And so you really have to take a whole person, multi-system approach to pelvic health. And so I've been addressing, I think, the hormones, but not directly all these years. And then as I finished a presentation for occupationaltherapy.com, and it was on postpartum and perimenopause well-being and longevity. That's what it was on. And so basically connecting in postpartum, we have these hormonal shifts that are very similar to menopause and perimenopause, and being able to see the information that we can get, the indicators during our pregnancy and postpartum that can help us make informed decisions proactively into our perimenopause transition, but also understanding the overlap so we can start to identify when it's more than just stress, right? And especially with women who are having babies later in life, and those transitions are directly overlapping. So really
Hmm.
being able to kind of ask the right questions, make the right connections when you're trying to get care and treat your symptoms. So that kind of started it. And then like I wrapped up the conference on the Friday, and then I went right into, I have a pelvic health membership, into a Peri to postmenopause conference that weekend. And so I was like, wow, all right, I'm like diving all in, and it was all in my head. And then Mary Campbell, who helped co-organize with Kelly Bancroft and host the M Factor screening recently, she reached out to ask who would be interested in organizing the M Factor screening. And I said, me, it's all right here. Like, and that was December. So we've been doing so much work with workshops and like just putting the word out. And the response has been amazing. People are thirsty for this information. They want connections. There's so many, because hormones are all throughout the body. We have so many symptoms that we experience, and it's really overwhelming and confusing to sort them out. So just having all these conversations to be able to help kind of figure out like informed approach to what's going to make you feel better, and for that longevity and well-being. And me personally, I'm definitely in this perimenopause space. So what I love about pelvic health is it's very gratifying, but it's also self-serving, because everything I learn about is going to directly relate to myself in some way. So
Yes, that's wonderful. And full disclosure, I mean, I've been in these workshops with Laura. She has included me, and so it's been really rich presenting, discussing all of these implications around hormones, pelvic health, self-love, uh, acupuncture, intimacy, which is Mary Campbell's work. I mean, it's been really incredible. And also to say, I have personally worked with Laura. So for my own pelvic health, and that's when I realized like how impactful that work is. Because I I think I also had the sort of limited notion that it's a very localized thing. And there's something about our creative energy coming from the womb, right? And that's like there's something about pelvic health that frees up a lot of other things that I think for me and I see again and again that are able to happen, you know, when we're more in touch with our sexual energy, when we're more freed up and not experiencing pain, for example, when, you know, we are wired for pleasure and not being able to have that pleasure is really depressing, and it can be a big weight kind of on our soul, on our body, on our ability to create and to feel good in the world. So I really I have a lot to say about this work. I really believe in it, and it's helped me personally. So what would you say is the connection then? So talking about pelvic health, hormones, bowel movement. Let's just start with this sort of triangle.
So, I mean, our bowel health is a window into how our internal systems are working, right? So, even our menstrual cycle, I look at it as a monthly report card. And what information are we getting every month about how our body is doing? Part of that also is our bowel health. Like, how, are we constipated? Are we in a holding rhythm? Do we have loose stools? Is there something that we need to look at to rebalance that energy? And, if we are constipated, we think about the job of the colon. The job of the colon is to absorb water from the stool. And that's how it starts as liquid, travels through. And as it travels through, it absorbs water and it turns into solid. So if it's not emptying the rectum likes to fill and empty. It doesn't like things to hang out. It's not a storage unit. So if it stays and is backed up into the colon, it will continue to its job and reabsorb water, make it more constipated and harder to go, kind of creating this cycle. But also it reabsorbs those old hormones. So thinking about what it's going to start to recirculate and potentially what it may confuse the endocrine system into not creating fresh hormones, and just understanding that type of cycle in and of itself.
Along with other toxins that are packaged to go out that we start reabsorbing when stuff
Yes.
is sitting inside the inside the door instead of outside, right?
Yes.
Beautiful.
And I always look at, what are we taking in? So what can we do nutritionally, or supplement or herbs, or hydration, like that way to be able to balance what maybe if things are moving too fast, sometimes like what is the GI system trying to get out real quick? What doesn't it like? So what are maybe there's some sensitivities, or what is the gut health like? But also the motility, what along the GI system may be interfering with the motility. And then for me specifically, that outlet, like at the end of the track, the pelvic floor, if there's dysfunction or imbalance there, then that can impact how we evacuate. So looking at all of those things as a complete, comprehensive approach.
Mm-hmm. And so when there is something more localized, is that usually muscle tension, or is there a number of different things that could be happening? There could be causing or contributing to constipation, for example?
Yeah, so muscle tension is a big one. So if things are tight and you're trying to push through something that's tight, you might not be able to get it through. But coordination. So if you are squeezing when you're supposed to be letting go, being able to work through the coordination piece of it, looking at the nerves that innervate those functions as well, and also looking at like tissue structure, right? So sometimes there's things like prolapse where maybe the rectum starts to slide down or into the vaginal wall. And that just makes it more difficult to evacuate, right? If things are kind of getting like pocketed or, to make it easy is to have like a straight gravity assisted elimination. So anything that's interfering with that, we can look at how to support it.
And as far as dryness, like looking at some of the other symptoms, especially for perimenopause, menopause, pain and vaginal dryness, like how can some work around pelvic floor or pelvic health in general contribute to lessening or eliminating those symptoms?
Yeah. So when I hear those symptoms, I'm curious about what the tissue is like. So is the tissue, has it lost some elasticity? Is it dry? How can we nourish that tissue, whether it's hormonal or non-hormonal? Um, then I want to look at the pelvic floor muscles and the fascia around it. So if there are tensions in those aspects, let's see how we can balance that out and get some good healthy blood flow and some good lengthening and shortening and breathing connected to that space. And then nervous system regulation is a big piece of what I do because, trying to figure out, well, if I'm finding tension, why is there tension, right? So that's kind of like the detective work that we treat what we
Mm-hmm.
find, but also like, let's really kind of get underneath this so we're not just constantly having to treat it, right? Like, let's really kind of see, is it an alignment, a structural thing that we can start to do some corrective exercises that bring balance to the pelvic floor? Or is there some sort, the brainstem is connected to the pelvic space. And if you think of the hierarchy of the brain system, the brainstem's at the bottom, at the base. So it controls the important things, right? Like the top stuff, like the frontal lobe, some of the personality stuff, we can live with. We may not have many friends, but we'll still survive. The brainstem coordinates our evacuation. We have to pee and poop in order to live. It coordinates our reproductive system. We need to, reproduce to live as a species. So it really cares about those things. So if there's a threat, if there's like a trauma, a stress, anxiety, an emotion, any sort of sense of decreased safety or fear, our brainstem will protect us in that pelvic space because it really cares about that space, potentially through tension. And that tension is where we start to see the symptoms, right? So the symptoms are more the red flags, the like sounding alarms of the body to say, pay attention to me. But a lot of times, like say bladder pain or UTI like symptoms, it's not necessarily a bladder thing. A lot of times it's what's around it and how can we calm that down and balance it, but also what is the sense of safety throughout the body and where do we need to send support there too.
Yeah, I love that you mentioned that because it's so much in my work too. It's about inflammation, nervous system activation. Because yes, you can do the right exercises for your, pelvic floor, and you can eat the right foods. But if you're not addressing that sense of safety, for example, and then overall inflammation with not just the foods that you're eating, but other toxic exposures, and again, those thoughts and concerns, it can be really hard to get the outcome that people want, which is to feel good, right? Or to feel great, ideally.
Yeah.
Um, so there was something you said about breathing too, because I
Mhm.
know when you were talking about this, the brainstem and the sort of regulation of all these bodily functions. I mean, breathing is included in that, and you mentioned how much the public health has this connection with breathing. Can you talk a little bit more about that and the role of the diaphragm, I guess?
Yeah. And that's probably the biggest tool that I start with. And I don't like to say everyone, but probably everyone. Because, the pelvic floor at the bottom of the pelvis and the respiratory diaphragm at the base of the rib cage, when we breathe, they move together like a piston, right? And so that's a direct way. If we've got tension in the pelvic floor, if we can learn how to bring that breath down and lengthen the pelvic floor. So many people know how to do a Kegel, right? They've heard about squeezing our pelvic floor, but not a lot of people have heard about how to lengthen our pelvic floor. So using the breath to lengthen, not push and bear down, but to inhale and actively lengthen, and start to feel that motion, that's going to help regulate, bring the blood flow, balance the tensions, bring the coordination for the strength back. And it also regulates the nervous system. So thinking about how it's interacting with the vagus nerve, any abdominal tension, that's also getting a nice massage for our abdominal organs too. So I used to say
Yeah.
it all comes back to the breath because that's a major pelvic floor foundational concept that I always teach. But now I say it all comes back to the nervous system because I think that's more comprehensive, but the nervous system incorporates the breath so much. So I wasn't wrong, but I feel like I was incomplete before.
Yeah, okay. Yeah, no, that's great. And I feel like so much of, in so many cultures, the notion of breathing into our bellies, right, is the seat of presence, and it's a way to calm the mind, and it's part of activating the vagus nerve, and calming down the entire nervous system. But I feel like beyond the belly, it's really this notion of like going all the way down below, like expanding pelvic floor, which is, like you said, it doesn't come easy for most people. It is something to really, you have to get in tune with. So, what would you say are maybe two or three really good practices for supporting? I mean, you already talked about the breath and learning how to breathe in a way that is helping expand the pelvic floor, but are there maybe another one or two tips for connecting with pelvic floor, with pelvic health in general? Something people can really do at home before they even go see a practitioner.
Yeah, I mean, it's a tricky question because there's so many different areas, right? I think for maybe just general pelvic health awareness, I think the breath, can you feel it? Can you feel that lengthening or can you see it? Like break out a mirror, right? Understand or feel, right? Sometimes I'll have people just lay on their side and in like a fetal position. So if your kind of hips are up and bent, that opens up the back of the pelvic floor.
Hmm.
And then you can just place a hand back there between your anus and your sit bone and just feel when you do that inhale and try to lengthen, can you feel under your hand like a kind of like bulge or an expansion? And then when you exhale, can you feel that come back in? Okay. And then it's not that Kegels are the evil, but um, being able to actively contract the pelvic floor in that direction of a Kegel. So closing the front muscles, lifting the back muscles. Can you functionally do that? Like if you're going to cough or sneeze or lift something heavy, it is really helpful to be able to do that. But also understanding if you've got pelvic floor tension, you probably don't want to be doing sets and reps of isolated Kegels, right? So just understanding the difference in what your own body needs um, are kind of the two big ones. But then if I would say kind of tune into what your body signals are. So again, going into the nervous system stuff, starting to tune into some of the pre-signals. Like what does your breath do? Do you tend to hold your breath or does your breathing get rapid? Does your heart rate change? Do you get other tingling sensations? Do you get little spasms? What are some of the body signals? And getting really good at paying attention to those can then help you not have to get to the sounding alarm symptoms, right? And like bladder pain or leakage or sometimes people have trouble actually initiating the flow of urine, so urine retention. So being able to like get those pre-signals and respond a little bit sooner can be really helpful.
Hmm. And as far as moisture, coming back to sort of the vaginal dryness symptom,
Yeah.
what are some of the things people can do as far as like even topical things that, they can do that are helpful?
Yeah.
Um,
So the breath again, if you're getting more blood flow, that's going to help with hydration.
mhm,
There are vaginal moisturizers that are like suppositories that are non-hormonal. So Reverie makes a really nice one that has hyaluronic acid that draws moisture in. And then different types of lubrication. So understanding a good, healthy, nourishing lubrication that works well for your system. Um, and self-massage can be really helpful. So, any type of massage is going to decrease tension, increase elasticity, and increase the blood flow. So potentially having like practice where either a therapist helps you with that or teaches you how to do that on your own. And there's different ways to do it with either your fingers or with different tools or with partners. And all those things are different areas that we can kind of get curious with and navigate and figure out what works for you. And then there's also hormone intervention. So estrogen is very protective and hydrating to the tissues. It helps plump up tissues. So sometimes people who experience leakage, maybe because the tissue, I hate the word atrophy, but we've kind of lost some structure to the tissue, that vaginal estrogen can help kind of plump up the tissues a little bit and just make a better closure around the urethra. Um, and certainly help with the
mhm,
hydration. So just kind of treating like if the dehydration is directly because of decreased estrogen, giving it what it needs, what it wants.
mhm. And in that case, it's a local um, cream, so it's localized action. It's not going to go into people's bodies. It's not systemic. Just to,
Right.
mm,
So all that kind of that confusion around hormone therapy, we have systemic hormone therapy that it goes through the blood flow, treats more of the body symptoms, such as the vasomotor, the hot flashes, the night sweats. It helps with bone density. It can help with those moods, right? Either
mhm,
depression or anxiety, some of the heart palpitations. But then if you think of more of the local pelvic floor and like bladder space, the vaginal dryness, the painful intercourse, the bladder symptoms, those can be treated with direct treatment, direct hormone therapy to those tissues, which is, a low dose and it doesn't get picked up and brought through the whole system. So understanding what symptoms are you trying to treat, to understand which approach is going to be most beneficial. What's really good to know is that even if you've had breast cancer, because it's a local treatment, you still are a candidate to be able to have that, and you can use vaginal um, hormone therapy at any age and for however long is what the recommendations are. So to not be afraid of that. And then there's different options too. There's like cream suppository or pill suppository or a ring or even just a little bit of cream that you just apply to certain local areas. So
mhm. Fantastic. Well, thank you so much. There's so much here, and we could, go on and on, but I feel like you've provided really direct, actionable steps. And so, really understanding our bodies, of course, breathing, feeling, massaging, and then applying, a topical and needed. Um, how can people connect with you, Laura?
yeah, so I work out of my home clinic in Old Chatham, and my website is Essential Pelvic Health. You can schedule a discovery call with me and see if you want to work with me and if it's the right fit. We also, specifically for kind of menopause stuff, we have a Facebook group, a community where it's called Menopausitivity. And, we're going to continue to share and update. And we're really looking to build resources so people can find local providers and continue the conversation and share resources and ask questions. And then I also have a Cycle Breakers membership that's going to be coming out. And I'm really trying to just continue these conversations that we're having and start to bring in more specific, detailed like trainings, and so people can have their questions answered. Whereas coming to see me one-on-one may not be available, so we can still get that good information. And we're going to be interviewing together. I'm going to be interviewing a lot of the local wellness and medical professionals in this space, so we can get everybody's expertise and wisdom and continue to share. So if you check out the Facebook group, then we're going to be sharing the link to be able to sign up as like like an intro member. And I want to develop it with you. I'm going to be asking you guys lots of questions and feedback, and it's going to be like a super low rate, just so we can develop a tool that is really going to be helpful for the community. So and then email. So if you get on the email list, we will be sending you all kinds of updates. So
beautiful. Yeah, and I'll put links to the Menopausitivity Facebook group and your website on the show.
Awesome. I appreciate it.
Yeah, thank you so much. And we'll see you at the next workshop.